Hello everyone. Today we are going to study the relevant content of the ankle. First of all, we come to understand the anatomy of the ankle joint. The ankle joint is the most weight-bearing hinge joint of the human body. Walking and jumping activities in daily life mainly rely on the dorsal extension and plantar flexion movements of the ankle joint. When fractures, dislocations, or ligament injuries occur, a complete reduction is required because ankle fractures are all intra-articular fractures. If the articular surface is not in a good position, it will cause weight-bearing pain or joint instability. And traumatic arthritis will occur in the future. Therefore, the treatment of ankle joint injury must be strict. First of all, let's study the structure of the ankle joint. The ankle joint is composed of the medial and lateral malleolus and talus at the lower end of the tibia and fibula. The posterior margin of the lower end of the tibia protrudes slightly posteriorly and is called the posterior malleolus. The lateral malleolus at the lower end of the fibular shaft is an important part of the ankle joint. The ankle mortise is composed of the medial, lateral, and posterior malleolus, and the talus is located in the ankle mortise. Secondly, from the three parts of the body, neck, and head of talus, only the neck is covered with periosteum, which is the entry and exit of the main nutrient vessel. It is wide anteriorly and narrow posteriorly for the body of talus, and the saddle articular surface above it intersurfaces with the concave articular surface of the lower end of the tibia. There are three articular surfaces in the lower part of the body of the talus, which coincide with the corresponding articular surface of the calcaneus and the articular surface of the head of talus forms the taloclavicular joint with the scaphoid bone. Then, the lower end of the tibia and fibula is connected by a strong and elastic interosseous membrane and the anterior and posterior syndesmotic ligaments, as well as transverse ligaments of the tibia and fibula. Finally, let's study the articular capsule of ankle joint. The anterior and posterior parts of the articular capsule of ankle joint are relatively relaxed, which facilitates the flexion and extension activities of the ankle joint. But the medial and lateral ligaments are relatively strong to maintain the stability of the ankle joint. The medial side is the deltoid ligament, which is divided into two layers. The superficial layer ends in the upper part of the sustentaculum tali, and the deep layer is in a triangle and ends in the neck and body of the talus. The lateral collateral ligament can be divided into three bundles: calcaneofibular ligament, anterior talofibular ligament, and posterior talofibular ligament, which are weak and vulnerable to injury. Then, let's study the function of the ankle joint. The ankle joint is capable of dorsal extension and plantar flexion, as well as varus and valgus of the foot. Varus and valgus activity of the foot generally occurs among the talocalcaneal, talovanicular, and calcaneocuboid joints. These interarticular activities can buffer the impact of violence and reduce ankle joint injury. In the dorsal extension position, the ankle joint can be widened by 1.5 to 2 millimeters to accommodate a wide anterior distance of the body of talus, so that the syndesmotic ligament is tense and the articular surfaces on both sides of the talus are close to the medial and lateral ankle joint surfaces to stabilize the ankle joint. During plantar flexion, the wider articular surface of the body of talus slips out of the ankle mortise. The narrow part enters the joint, resulting in the narrow of the ankle mortise. Although the talus is still in contact with the surface of both ankle joints, the inferior tibiofibular syndesmotic ligament becomes loose. The ankle joint appears unstable, and ligament injury, especially collateral ligament injury, is likely to occur. Therefore, the ankle joint examination can generally be performed from observation and palpation. The first is observation, and the common cause of ankle swelling is ankle trauma, of which ankle soft tissue injury is more common. In the early stage, anterior malleolus is predominant, and then total ankle swelling may occur. Next, observe the active activities of patients. 0 degree at the neutral position of the ankle joint is a state in which the long axis of the foot forms a 90-degree angle with the longitudinal axis of the lower leg, and the amplitude of its movement is the degree of movement, which is used as the recording standard. The patient voluntarily performs dorsal extension, plantar flexion, varus, and valgus activities, so as to conduct the bilateral contrast examination. First, the ankle dorsal extension mainly examines the activity status of the tibialis anterior and extensor digitorum longus. During the examination, the patient is in a sitting position with both knee joints flexed at 90 degrees and both lower legs naturally dropping, and the patient is asked to perform the ankle dorsal extension from a neutral position, which can be normal up to 30 degrees. Perform bilateral contrast examination. Second, ankle plantar flexion is mainly the action of the triceps surae. The body position is the same as before during the examination, and the patient is asked to perform the ankle plantar flexion, which can be normal up to 45 degrees. Perform bilateral contrast examination. Third, varus of the calcaneal talus joint. The varus movement of the normal foot occurs in the calcaneal talus joint. During the examination, the patient sits on the examination couch, with both lower legs dropping spontaneously, and is asked to perform the varus movement, which can be normal up to 30 degrees. Perform bilateral contrast examination. Fourth, valgus of calcaneal talus joint. The body position is the same as above during the examination, and the patient is asked to perform the valgus movement, which can be normal up to 30 degrees. Perform bilateral contrast examination. This is followed by palpation. First, palpation of bone tissue. The lateral malleolus is located in the distal fibula. The incidence of fractures caused by trauma is high, and the local examination is performed for tenderness, changes in bone contour, and abnormal movements. Depression can be palpated in front of the lateral malleolus, below which is the tarsal sinus, and the lateral surface of the talus neck can be palpated when the tooth is varus. The distal tibial fibular joint is proximal to the talus and may separate due to ankle trauma. Second, palpation of soft tissue. Attention should be paid to the presence or absence of skin damage, bleeding, foreign body contamination, of wounds, and disorders in lymph blood circulation. According to the special examination, we have a preliminary diagnosis of ankle diseases, and then imaging-related examinations are required to confirm the diagnosis. Well, that's all for this lesson. I hope you can review it well after class. Thank you.